you have atrial fibrillation, there's nothing you can do about it. We can just burn part of your heart off, so that it doesn't go irregular anymore. But there's nothing else you can do. There's nothing you can do to fix it or repair it. All we can do is burn it and destroy it. Or I had a heart attack, and part of your muscle is gone, and it's just gone. There's nothing you can do about it. And so if anybody tells you there's nothing you can do about it and you're still alive, then there's something wrong with that, right? Because as long as you're alive, there's something you can do about it.
Welcome to the Healthy Heart webinar, everyone. All three of us are in the house today. Excited to have you guys here. Look at how fast they're hopping on. This is great. I'm going to see if I can get Facebook to work. Before we even get started, I'm just going to put a disclaimer out here. Yes, Dr. Saunders is a medical doctor, but he is not your doctor, which means please consult with your primary healthcare provider before you implement any of the things that we discuss here today. Even though I know a lot of you don't, I still have to say that. So
it's interesting though that you don't. Yeah, I mean, we're so used to using the word doctor for somebody who helps you with your healthcare, and now we have like a lot of others that are not doctors that are helping people with their healthcare. So we have to say, what do we say? Practitioner, healthcare provider. Yeah. So, and some of those are doctors, and some of those are not doctors. And you know what? Just so that you know, having that doctor does not make you better at helping somebody with their healthcare. I've worked with some PAs, physician's assistants, who are just amazing because of one thing. So here's what you look for. Here's what to look for. This is your bonus for today. What to look for when you're looking for someone to help you with your health, a consultant. Look for someone who's continuously learning, who's growing. If you ever find somebody who knows it all, say, "Nah, I already know everything," then you definitely want to avoid that person, because they don't know anything and they're not going to learn anything new. So just so that you know.
And I was going to say the other word that comes to my mind too is looking for a doctor, or looking for someone who's curious, because I feel like you're always curious, like, okay, what's really going on here, or what could be causing this, or what could we do about this? And I think that's one of the reasons that we really appreciate you so much. You don't just settle for the diagnosis. You're like, your body wasn't created to be that way, so we're going to figure out where it went wrong. And I just love that. So,
and willing to research. Dr. Saunders is willing to research if he doesn't know, or just in general, he loves to research. So send us your problems.
Yes. I've mentioned this before, but we've been on trips with Dr. Saunders where he's up at, like, I don't even know, some ungodly hour.
4 a.m.
doing research, and then he comes out, I figured it out. I love it.
He does that.
The best.
I'm witness.
A lot of times it's probably for one of the 20 people that are on the Barton team that asked him a question and want to know, okay, this is happening in my body, what's going on? And then he just stays up and figures it out. So
I had a patient this morning. I called the patient at an ungodly hour, and I'm like, I'm going over your test results and they're not adding up. There's something wrong here. Your aldosterone is 0. And your sodium potassium ratio is off, and blah, blah, blah. And he's like, okay, let me tell you what happened. And he said, I went to the cardiologist, he gave me this drug, and then I got that drug, and that explains it. It's the drugs you're on that are causing these problems. So we figured it out.
Yeah, and unfortunately that is a common message that we get from a lot of people that are hopping on these webinars, is they sometimes get to the point where they're on so many different things that they're not even sure what's causing the side effects. And so, or they didn't know about the side effects of all of the medications that they're taking, which is the other kind of scary thing.
That's a kind of scary thing. Yeah.
So how do you even know where to start with what's wrong? Well, unfortunately, many of them are just given another medication to deal with that side effect. And so I'm not making this up. This is just what these people have told me. So anyway, All right, let's go ahead and get started. We are going to chat about how to keep our heart healthy. And you know what? I have gotten a bunch of emails. So I'm going to go through my emails as well. Lots of good questions. But our topic for today is, what are my treatment options for heart problems? And so one of the questions that was emailed to me was, I have had a heart attack. Can I, oh, how did they word it? Basically, can I heal my heart? And so, first of all, is that an option? Can we repair our heart?
Yes. Okay. So this is a very important point. If anyone ever tells you, and that's where these practitioners I was saying, look for somebody, I don't care if it's a nurse, PA, doctor, DO, MD, whatever. The title is not relevant. What's really relevant is, are they looking for information? So we have something here that's a common problem, and that is, oh, you have atrial fibrillation. There's nothing you can do about it. We can just burn part of your heart off, so that it doesn't go irregular anymore. But there's nothing else you can do. There's nothing you can do to fix it or repair it. All we can do is burn it and destroy it. Or I had a heart attack, and part of your muscle is gone, and it's just gone. There's nothing you can do about it. And so if anybody tells you there's nothing you can do about it and you're still alive, then there's something wrong with that, right? Because as long as you're alive, there's something you can do about it. Living is growing, it's improving. And so you say, okay, I had a really bad heart attack, but I got the bypass surgery. You wake up in a hospital and you're all in a lot of pain. And then they say, well, we saved your life. And there's nothing you can do about it. Well, that's what they told former President Bill Clinton about his heart when he was after he had bypass surgery and it was getting blocked up again. They said, there's nothing you could do about it. But guess what? He did find something he could do about it, and it got better. You can get better. After you've had a heart attack, you can get better. I had a patient yesterday. His dad is 74 years old, and he hikes up in the mountains in Washington State. And his doctors keep telling him, oh, don't go up in the mountains. That's really bad for you. High altitude, low oxygen. You've had a heart attack. Not a good thing. Don't do that. And he's like, you guys, not like this. You guys don't know anything. He had his first heart attack at age like 48 years old, 44, 45, somewhere in there. He was in his 40s and he had a heart attack. And his doctor said, don't do anything. Don't do anything. You're going to die if you do something. And he just kept telling him, he kept doing more and more and more, improving his exercise, doing more exercise, eating well. He's eating 2 meals a day. That's all he does. He does intermittent fasting. And so now here he is in his 70s. He's almost doubled his age from his first heart attack because he didn't listen to all those people that said, you got to rest. There's nothing you can do about this. It's just going to get worse over time. No, he got better, and he doesn't have chest pain, and he doesn't have heart disease, and he hasn't had another heart attack. And he's doing high altitude. So the answer to your question is, if you're alive, you can get better. Is if you understand how and you know what to do.
Awesome. So let's talk a little bit about our solution kit. So you've had a heart attack, you want to repair your heart. Is this where you go? Is this where we start? What do you think?
This would be a good place to start. So in the Healthy Heart Solution Kit, the things that we're talking about are, what are the things that injure the heart? And there are several things to consider when you're looking at, why did I have a heart attack in the first place? Do I have a genetic abnormality? Is there some gene in that I have that is causing me to get clots in my vein, arteries, and blockages in my heart? Do I have a lot of stress? We talk about stress and how important that is. Adrenal stress is something that prevents you from repairing the clogs in your heart. And so if you don't have, if you have a lot of stress, then you don't repair very well. You don't repair your arteries very well, and you end up with what? Well, clogs in your arteries. And if that's in the heart, that's a big deal, right? But the other thing about stress is the angina. Remember that we talked about this a lot, how the blood vessels constrict and stop the blood flow to the heart. And like 60% of heart attacks are not clots, but constriction of blood vessels. And so that's an important thing. We talk about the unimportant things, like things that you don't need to focus on, like cholesterol and blood pressure. Or if you look at them, like if you have high blood pressure, ask the question why. Don't just like start taking pills for blood pressure. Go, why do I have high blood pressure? Like the guy today, this morning, that I called him early in the morning, and he told me the story of what happened with his high blood pressure. I took that medication and that medication, and those were the medications that were causing the problems. And his blood pressure went up because of a medication he was giving. He ended up with low potassium. So we figured out what that blood pressure problem was, and now he doesn't need medications because he just has to get enough potassium and keep his ratios balanced. Knowing why is what's important. So as you go through the Healthy Heart Solution Kit, you're going to look at the different things and say, does that apply to me? 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 And then you're going to apply the things, and you're going to get on a good program. You're going to take the right supplements. You're going to eat the right foods. You're going to exercise regularly. You're going to increase your exercise. Why increase? Because that's what life is. Life is growth. If you're not growing, you're not living. So if anybody tells you, oh, don't do anything, stay in bed, guess what? They did research on bed rest. Guess what? Bed rest helps. Yeah. So like if you take all the illnesses that have been chosen for bed rest, things like the doctors told my aunt when she was like 5 or 6 years old, she had rheumatic fever. And they told her, you have to be in bed, like you can't ever get out of bed. You have to use a bedpan. This is a little girl, right? And they told her that for 6 months, she couldn't get out of bed. And you know what? It affected her life. Her metabolism completely changed at that time. She got obese. She ended up dying of cancer at age 54. She was really young. And I'll bet that a lot of that, because cancer is a metabolic disease, I'll bet that all started from being in bed for that long. So rheumatic fever, even like pregnancy complications, all kinds of illnesses, infectious diseases, and problems with arthritis. And so of all of those things that doctors have recommended bed rest for, guess what helps? Guess what bed rest is good for?
Nothing.
Nothing. You're right, Cheryl. Nothing. There wasn't one thing that bed rest was helpful for. So don't go to bed. In fact, the people that heal the fastest, that heal the best, like after surgery, are the ones that get out of bed the soonest. They're the ones that do better. The doctor says, no, you have to be in bed for 2 weeks. They go, forget that noise. I'm not laying in bed for 2 weeks. And they get up and walk around and start doing stuff, and they heal. They don't get infections. They don't get complications. They do better. They heal faster. So that's the thing to consider, is when you're alive, and if you have heart disease, fix it. If you don't have heart disease, avoid it.
So people who are typically, maybe they've had a heart attack, they're talking with their doctor, what is the typical plan for someone? What are they typically, are they prescribed meds? What happens typically? You know, we're talking about the different treatment options for heart attacks, and we've talked about the Healthy Heart Solution Kit, but what else do you find that's often recommended for people?
Well, in the medical profession, there's what's called the standard of care. Standard of care means this is what everybody does. And as long as you do what everybody does, you're safe. And so it's safety. Nobody can fault you for giving somebody a beta blocker, even if it kills them. If it kills your patient, you know what? You can't get any fault, because that's what everybody does. So one of the problems that we have in healthcare is we don't individualize the treatment for specific individuals. Oh, you need this, but this would not be good for you. They don't do that. that I had my stepmom, actually, she just last week, her doctor a few weeks ago, well, a few months ago, had given her a beta blocker. Well, she has COPD, chronic obstructive pulmonary disease. She has lung disease like asthma. And then so the beta blocker blocks the beta, which dilates the blood vessels in the bronchioles to allow her to breathe. And so the beta blocker blocks that, so she gets constriction and then she can't breathe. And then she takes a beta agonist, those inhalers, the albuterol inhalers, and they don't do anything because the beta blocker blocks them. So here you have a problem of somebody who can't breathe, who's given the standard of care for having a fast heart rate. And instead of treating the problem, they treat the symptom, which is causing another problem. So I told her, do not take that medication. Because she called me and she said, I can't breathe. And I've been using my puffer over and over again. It's not working. So she ended up in the ER with that. And so then day before yesterday, she goes back to her doctor, and the cardiologist didn't know what to do. So gave her a different beta blocker, another beta blocker. She called me and she said, is this right? I said, no, it's not right. That's what put you in the problem in the first place. She said, but it's a different name. But it's the same issue. It's the same process. The doctor didn't know what to do, had no options, because the standard of care is everybody, if you have a fast heart rate, you have to use a beta blocker. And so we talked about other options and things that she could do besides that. So you got to be really careful. You got to know what you're doing. Because I guarantee you the doctor has a standard of care and it may not apply to you.
There's a note here from Annie. As a former cardiac ICU nurse, I'm sick of the meds doctors give.
Wow.
So they really use a one size fits all approach to every problem then. If you have a cardiac problem, then you just follow plan A, B, C, D, E. That's kind of scary.
It really is, because human beings are so highly variable, like the guy I called this morning, his blood pressure is elevated because his potassium's low, and his sodium is really high, because he doesn't have any aldosterone, because he was given a drug that caused that problem. And the doctor had no clue what to do. And I immediately knew what to do as soon as I saw his test results.
Wow. And that's another reminder too. I mean, you speak very highly of testing because you want to know what's actually happening in the body. Is that it doesn't sound like that happens very often. In fact, we've recommended tests to people and they're like, my doctor doesn't even know what that is or wouldn't do them. Yeah,
there's a lot of, I was thinking about this the other day because the doctor hadn't tested this, my stepmom about that. Her issues and wasn't aware, because she has a pulmonologist that she goes to for the lung problem, and then she has a cardiologist for the heart problem, and they don't talk to each other, and they don't ask about what the other one's doing, and they don't know that she has COPD because they're so narrowly focused on the heart. And it was described to me this way. So somebody said, it's kind of like you're at a football game and you're the referee, and they give you a soda straw. And you have to referee the entire game looking through a soda straw, and how good of a ref could you be if that's what you had to do? But that's what they're doing. That's what doctors are doing. Is they're narrowly focusing on this one little part of your body and not looking at the big picture.
And we did talk about this too, about, finding a doctor who is curious or learning or wants to understand. There are a lot of good ones out there. I want to make sure that we're mentioning that because we've met some of them. Dr. Saunders knows some of them who are doing great things. This isn't everyone, just many that you guys are letting us know about in your comments and emails. But find somebody who is willing to see you as a whole person. That makes a big difference.
Yeah. So there was a question popped up. What is it that the beta blockers, how do they affect the lungs? It's the bronchi. They cause or if you already have issues with bronchial constriction, they prevent the dilation of the bronchi in the lungs. So they're not good for people with asthma or COPD.
We're going to dig into some more of these questions, guys. If you would like to be on camera, will you go ahead and click that raise hand button if you're watching on Zoom? And then I will add you as a panelist, and you can go ahead and join us. We'd love to see your happy faces. Make sure, again, I don't think I need to remind you, but just make sure you're fully dressed. And yeah, you will be muted. But okay, so I'm going to dig into some of these questions here. Here's one from Julie. I do appreciate people who are humble and don't think they know everything. My mom would often say the people who know the most are humble, and they speak in a way that and in an everyday language that an ordinary person can understand. Thanks. I love you guys. Oh, thank you.
Sweet.
Nice.
That's what my husband says of Dr. Saunders. He knows a ton, but he doesn't make you feel like he knows and you don't know.
Yeah. Yes, agreed. Okay, Anonymous says, if diabetes is said to be a cause of AFib, and I have both, and if I have gotten my blood sugar down to 100, is it time to question if I need my sotalol? Like, this sounds familiar, but not quite sure what it is. Okay, for my AFib anymore. Do I need to take that for my AFib anymore?
Okay, as to whether you take that or not, sotalol is a beta blocker, and it keeps the heart slow. It slows down the heart. So whether you need your heart to be slow or not just really depends on you, and that's just for how you feel. It doesn't make you better. It doesn't improve the atrial fibrillation. It doesn't stop you from getting atrial fibrillation. What it is it slows down the rate of your heart. So the other way to look at this is, why does the diabetes induce atrial fibrillation? What is that connection? The connection is energy. When you have type 2 diabetes, you have high insulin because you have insulin resistance. Insulin resistance causes you to have use less fat for energy. So it actually blocks you from using fat for energy. So a normal heart uses about 60% of its energy comes from fat, and about 40% comes from glucose or sugar. When you have type 2 diabetes and insulin resistance, that can be like 40% or less from fat, and 60% or more from glucose. And that's not a good supply of energy. That causes damage to the mitochondria. You end up with making less energy for the heart. And so the reason you get atrial fibrillation is because the muscles, in this case, and the electrical system doesn't have enough energy to keep going all the time. And so what happens is they start going at different times, and that's called fibrillation, because they're not all working together in what do you call it when they're working? What's community with each other? Yeah, they're not all contracting together. They're contracting irregularly. So. And that's an energy problem, and diabetes induces that energy problem. So it's not just your blood sugar. What you want to know is, what's your insulin resistance? So if your insulin levels are down at a fasting level of about 3, 4, 5, 6, somewhere in there, between 3 and 7, then that's great. That means you have good insulin sensitivity. If your insulin levels are 10, 11, 13, 15, 20, 30, then you clearly have insulin resistance, and that's going to be still a problem. So it's not just a matter of getting your blood sugar under control to stop the atrial fibrillation. You really need to get the insulin resistance down, and then start improving the energy of your heart. And the way you do that is with exercise.
All right, I'm going to read this message here that I got. This is from Joyce. I don't know if she's on, but it says, my question is, I had my yearly blood work run in February. All my results are in normal range, except for my glucose, which is 179. Joyce is taking 2 synochroma, 2 berberine per day, as well as healthy gut, healthy heart support, fiber greens. And she's been doing all of this for 6 weeks. My blood pressure was 100/60, so my cardiologist agreed to take me off completely from metropolol, which is the word that I was knowing, kind of like that other one, you know. All right, I was on 25 and then 12.5 milligrams. At my next visit, I asked to be removed from losartan, 25 milligrams, and atorvastatin. Atorvast. I can't do these. These are big words. I hear these all the time, but someone's got to tell me how to say them. Okay, 40 milligrams. As my cholesterol is at 145. Dr. Saunders said in one webinar that more people die from low cholesterol and showed a graph from a medical journal. And I'm struggling with my weight. My cardiologist says, no, he does not remove people from statins. Would Dr. Saunders know of an alternative for statins that does not raise glucose and cause weight gain? I am happy to report that I've lost 7 pounds last month using intermittent fasting from 6 to 5. Just a note, Joyce has had triple bypass with 5 blockages in July of 2021 and walks between 5,000 and 7,000 steps each day.
Wow. Okay. Wow, Joyce, that's a lot. Okay. So, walking, great. Intermittent fasting, great. Good work. That's actually really useful. As far as the statins go, make it your decision, not my decision. Your decision, not your doctor's decision. Anyone who's telling you what to do is your advisor. They don't own you, and they can't tell you what to do. Well, they can tell you what to do, but you have to decide what you're going to do if somebody tells you what to do. And so you decide what is best for you. And just so that you know, your doctor has a lot of research on groups of people. So populations, for example. So the doctor can say, well, I know what's best for this population. But does the doctor know what's best for any one individual in that population? No, we have no research on that. We have no research on you specifically. Nobody took you and said, what is best for you? So you're the only one who needs to figure that out. So how do you figure that out? Well, you study, you look, you learn, you pray, you ask, you seek, you knock. All of the things that you're going after are looking for what is best for me. And so I had somebody yesterday. She called me and she said, "Oh no, it was my stepmom." I told her, yeah, the doctor put her back on a beta blocker, and I said, no, not a good idea. And she said, okay. So I talked to one of my friends who's a nurse, and this nurse has done. She's a nurse practitioner. She's done a lot of research on the drugs, the blood pressure medications, especially. And she told me that I shouldn't take that at all, but not to let my cardiologist know I wasn't taking it. Just don't take it. And I'm like, okay, I kind of like that nurse. because the nurse practitioner knows that the doctor can't back down from that's the standard of care, that atorvastatin is a standard of care. And if you don't fit in the box, it doesn't matter whether you fit in the box or not. That's the standard of care. The doctor cannot tell you not to take a statin drug. That would be against the law. So for the doctor to keep his license, he has to prescribe it, but you can decide if that's right for you or not.
Very interesting. Okay. All right. Let me see here. Julie said my sister just went in for open heart surgery, but she texted me and her words were that she had a blocked artery and that they're doing surgery at United Hospital. She had previously had an ablation for arrhythmia and AFib. Okay, that was it. Just trying to see if there was another question in there. Okay. Danielle says, I eat half of an avocado and walnuts every day. I just recently found out I have a mild buildup of plaque in my right carotid artery. Could this cause that?
No, not specifically. Walnuts are pretty good sources of omega-3, and they also have omega-6. The ratio is not great, but it's okay. Avocados, same kind of thing. It's about 15-to-1 ratio, omega-6 to omega-3, but they don't have a lot of that. They're mostly omega-9 avocado oils. So as far as the oils go, they're fine as far as they don't have any carbs in them. So the plaque in your carotid arteries happens because there's damage to the endothelial lining called the glycocalyx. So this glycocalyx is like a gel on the inside that makes the blood just move really smoothly through everything. And when it gets damaged and the cells underneath are exposed, a clot forms on there because there's damage to an artery. And that's you have to clot off arteries or else you'll bleed to death. You'll just get internal bleeding and die. So if there's any damage to arteries, then that's what happens, the clots form. And so what needs to happen is then repair of that clot. You need to dissolve the clot and have the endothelial lining produce the glycocalyx so that you have good flow through that artery again. So the way to do that is to find out why. Why does that happen? Do you have inflammation? If you have a lot of inflammation, then you're very likely to have clots that form in your arteries because there's a lot of blood flowing through there all the time. And anywhere that there's slowing of the flow or something that's like the glycocalyx is worn away, then you're going to get clots there. And so in the carotid arteries is a common place to have that. So do you have inflammation? Do you have a lack of nutrients? Are there some nutrients, especially the fructose, galactose, all of the sugars that are used for repairing or for creating this glycocalyx? Some people just lack glucosamine. And you add glucosamine and that improves the blood flow dramatically because that allows the glycocalyx to be formed more easily. Another thing might be if you have a genetic abnormality like lipoprotein little a can be a problem. If you have autoimmune types of diseases, that would be a problem. So your next step is to ask the question why. So to see something and go, okay, there's some what's called intimal thickening in the carotid arteries. So there's plaque in the arteries, and just say, okay, let's treat the plaque. Well, how do you treat the plaque? Well, that depends on what caused it, right? If you know what caused it, if you say, well, it's because I have this chronic inflammation. Well, how do you know you have inflammation? Well, my sedimentation rate is high, my C-reactive protein is high, or I have a high ANA, autoimmune diseases, or whatever. So you start testing to find out, do I have lipoprotein A problems? Do I have problems with the blood, the sugars, sugar molecules? So looking for the cause, the underlying reason why is the next step. You're muted.
I want to show this graphic. I'd like to pull up just kind of this endothelium glycocalyx thing. I think it's good to see, but I never know if I'm showing the same one as I did last time. So I'm going to click on this.
It might be too graphic for our people.
Oh boy, I don't think that's the one.
That is graphic.
Well, this isn't the one that I was wanting to show, but there we go. This is talk with. I think this has to do with sodium, but you can still kind of see.
Yeah, you can see where the endothelial cells are around the blood vessel, and then this glycocalyx layer. and it's amazing. This is so beautifully done and wonderfully done. It's amazing.
Yeah, the body's just cool. So kind of like to show that just to give you an idea of what it looks like. Those of you who are trying to come on as panelists, I think it's only been a couple of you, but it's not allowing me to enable your cameras, but I'm going to go into settings and see if I can do that. Okay.
I have a question. That image showed a negatively charged glycocalyx.
Right.
Why is it negatively charged?
Okay. So a negative charge on there, it prevents stickiness. So nothing sticks to it. It's just the blood moves through it really smoothly. Yeah, you look down, it says negatively charged glycocalyx layer. It offers no resistance. It's like a gel, and it's just amazing.
So it's like a slide, things just slide on through.
Yeah. I thought you were going to say slime, and
Well,
that's actually what that's actually what it is.
Oh, that's reminding me of our webinar yesterday. We had a couple of people that were asking about zombie cells, and it just reminded me we were talking about that. Oh, that's funny. Anyway, you'll have to watch the replay on that one, guys.
Yeah, we were talking about slime and zombie cells yesterday.
I know. And then I've been doing physical therapy for my knee, and he's like, "Okay, I need you to do a zombie walk." And I was like, "What is with all the zombie stuff? I don't know. It's weird." All right. Okay. Alma, I had a recent echocardiogram and it showed trace leakage in mitral and tricuspid valves and minor leakage aortic valve, but the valves are okay. Ejection fraction 65 to 70%. They say do nothing. My abdomen area is bloated, but I'm not really overweight. Can this cause fluid in that area? What do you think? I am a youthful 76-year-old. Love it.
Okay, you youthful 76-year-old. It's beautiful. Okay, so trace regurgitation is not anything to worry about. That's actually fairly common. There isn't really anything to do about it. If it's just the mitral valve, then it could be an energy problem. It's really interesting. The mitral valve is the only one. The valve has like a wire going to it that pulls down to a muscle. And the muscle actually kind of pulls the valve into place as the valve opens and then it closes. And because just the system is so perfect, I wish I could explain it all. This is a low pressure area as the blood comes in, and this is a very high pressure area where the ventricle is pushing all the blood through your entire body. And so how does that valve hold on to all that pressure? Well, there's a wire that kind of, or several wires that kind of hold it down to the muscle. As the muscle contracts, then it pulls that valve down. And so you get a little bit of regurgitation. Sometimes the little bit pops up and it goes through. And that's okay. Unless you get a lot, then you may need help with the muscle. That may be an issue. But it's just a beautiful system. So your valves are okay. You are a youthful 76-year-old because your ejection fraction between 65 and 70 is great. So over 50 is considered normal, but optimum is around 70. So you have a great ejection fraction, which means the amount of blood that's pushed out of the heart every time it beats is 70%. So that it beats 70% of the blood gets pushed out every time. If you have a 20% ejection fraction, then it's just 20% of the blood gets pushed out every time. That's really bad. That's like people who are dying. Their heart just isn't working. It's just barely going. But 70%, that is really good.
She asked because if it causes bloating in her abdomen.
Oh, okay. Yeah, the bloating part. Okay. So no, the answer is no. None of that is gonna have anything to do with bloating. The bloating in the abdomen comes from primarily two sources, and it's because of what I'm saying is it's very unlikely that you have any fluid in your abdomen. That's not a common thing. It's really uncommon, and that would be like really bad things like congestive heart failure and cancer, and inflammatory disease, infections. It's really bad stuff that puts fluid in the abdomen. So then why does bloating happen? Well, gas in the intestines, that's a common cause of bloating. But an unusual common cause that people don't think about is that the diaphragm of your diaphragm for the lungs is a muscle like this, and as it flattens out, it pulls the lungs down, and that expands the lungs, and it fills your lungs with air. And so that's all it's doing, is creating negative pressure. But we don't think about the fact that as that diaphragm gets pulled down, it's also pushing all of your intestines out, and you get bloated. And so there was a study done on this was like in the 1920s. It was a long time ago, and they took 100 people that had this severe bloating, and they didn't know what to do, and the doctors tried everything, and they examined them, and they don't find anything. And this is like before ultrasound, before CT scan, before MRI. They didn't have any of that stuff. So do you know how they looked inside to see what was causing the bloating? It's exploratory laparotomy. And that means they cut everybody, like 100 people, they cut them all open, opened up their belly to look inside. And you know what they found? Nothing. In 100% of them, nothing. They found nothing. And so they couldn't figure out what was wrong. It was the anesthesiologist that figured it out. The anesthesiologist is looking from the head. So he's at the head, and he's looking down at the body. And he said, that's the funny thing. As soon as I put the ether mask, so they used ether in those days to anesthetize, as soon as they started going to sleep, the belly went, dropped down. The bloating went away immediately, instantly, on every single patient. As soon as they were anesthetized, the bloating disappeared. And it was 40 years later that someone finally figured out, that saw that study and finally figured out what it was, that it was the diaphragm causing the bloating, that the spasm of the diaphragm would push all of the intestinal, everything in the intestines, everything in the belly, including the intestines and stomach and everything, would push it out. And people would feel like they were pregnant and bloated and all of that stuff. And they were uncomfortable enough to undergo exploratory laparotomy to find out what the problem was. That's how uncomfortable it is. And so another thing to think about if you have bloating is consider the diaphragm. You might have spasms of the diaphragm, in which case, what do? The treatment is so simple. It's breathing exercises, yoga breathing, or Wim Hof breathing, where you use your diaphragm to push, to suck your air in, push your belly out. So you're not using your chest muscles. You're not using the chest. You're using the belly to breathe. So they also call it belly breathing. And you just lay there and you do that belly breathing, and then the bloating goes away all by itself. It's amazing.
Someone had recommended, I think, Insight Timer, which actually we've used that before to do some breath type of stuff.
Yeah.
And wanted to say there was one other one too that someone just sent me. I'll have to think about that. If I remember, I'll let you know. But that may be something you guys want to look into.
I go on YouTube. And get one of the Wim Hof YouTube videos and just lay it down, put the phone down beside me, lay down, and I listen to Wim Hof telling me how to breathe.
Isn't that crazy? But it's such a good thing to do. So good. In fact, we do have a webinar. Actually, was that on the Healthy Heart webinar? I think so, where we had our friend Esther come on. So if you guys go to bartonwebinar.com, that's our hub for our webinars, you'll see a link to our YouTube channel, and you'll find one that we did. And she guides you through a 5-minute breathwork session. And so that would definitely be something I would recommend. We have a question here from Tony. Tony's actually on video. Hi, Tony. Good to see your face.
Tony?
How do blood thinners like Xarelto starts with the next. Okay, affect the heart. Thanks for your encouragement, everyone. I appreciate it.
Okay, so Xarelto is a something that thins the blood. It works on the clotting factors, and the way it affects the heart is to prevent clots from forming. And that's a great thing when you have heart disease because you don't want clots. Clots are what's the problem, right? So, so cardiologists use this to prevent clots from happening. They're mostly thinking of like vascular disease to prevent pulmonary embolus, right? The big clots from forming, but it also prevents clots from forming in the arteries. So in the heart, so you actually do prevent heart disease to some extent from Xarelto. And as long as you're not having side effects, I don't know. I don't automatically take people off Xarelto. But people often come in and they do have side effects. It's kind of common. And so I look for alternatives. And so alternatives would be, how do you prevent clots? Well, get enough omega-3s, get your omega-6 to omega-3 ratio to about 2 to 1 to 4 to 1. And then get vitamin E and eat garlic. You can crush garlic. Crushed garlic is actually the best way to do it. And it's better to do the crushed garlic after you've cooked the meal. Then you crush the garlic in it and mix it in so that you don't destroy all the allicin in it. And then let's see, garlic, fish oil. Taking a fish oil supplement is a good idea anyway, because that gets the inflammation down, but it also prevents clotting from happening. And there are some herbs you can take too. Aspirin, it's okay. White willow bark is probably a better option. Those.
Awesome. Okay, cool. If any of you guys want to be on video, you are welcome to hit that raise hand button and I will add you as a panelist. You can hop on. And I think once you're a panelist, I don't think you can post in the Q&A anymore. You may only be able to post in the chat. So just a little heads up. Okay, so let's get to some more questions here. Jill says, my question is about high blood pressure. What causes the extreme variations in systolic blood pressure? One time it was 150, the next day 118. Diastolic remains the same. When I had high blood pressure, she wanted me to take a blood pressure med to lower it, but because it dips, I'm concerned about taking it.
Oh, good for you. That's really smart. That's actually real. That's so important what you came up with. See, the doctor's so narrowly focused. All they see is that you had one time your blood pressure was high, and instead of looking at the big picture and saying, what does that mean? And does it ever come down? So the question we're asking with blood pressure is not, does it ever go up? Everybody's blood pressure goes up. 150, 118, 120, 160, going up is a normal thing. Why? Because you need more blood flow. Pressure increases flow. To what? Well, usually to your brain, sometimes to your heart, sometimes to your kidneys. So primarily the brain, the heart, and the kidneys are going to scream for more blood pressure because they can't increase their blood flow any other way. They need the pressure. So for that reason, you sometimes have to raise the blood pressure to get blood up to your head, for example. That would be a common thing. But then when you're quiet and relaxed and everything is functioning well and you're not needing extra blood flow anywhere, then the pressure should come down to normal again. Wow, 118. You're exactly right. You should not be taking a blood pressure medication if your blood pressure comes down into the normal range when you're quiet and relaxed. So people often go into a doctor's office and they're kind of nervous in the doctor's office and their blood pressure goes up. It's called white coat hypertension. So then they go home and it drops down. And that was one of the issues that my stepmom was having, was that she would go home and she would get dizzy and she'd be like ready to fall down. She's fainting from low blood pressure because the doctor put her on a blood pressure medication because it was high in the doctor's office. So what I do instead, and this is something you can do, is measure your blood pressure twice a day and do it for a week or two, twice a day. And if you see this kind of a pattern, goes up, goes down, goes up, goes down, goes up, goes down, you're normal. That's good. If you see a pattern of low, 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 you got a problem. If you see a pressure high, 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 you've got a problem. And you got to find out why you have that problem. And it's not just like take a pill. It's why do you have that problem? Why is it there? Why is that happening? Because there's a lot of different reasons, over 100 reasons why your blood pressure could be high. This is not like a simple oh yeah, that means you have heart disease. No, that's not what that means at all. You could have hormone imbalances, you could have kidney failure that could have nothing to do with your heart. People that have strokes, their blood pressure is super high. Why is it high? Because the brain is screaming for pressure. I need more blood flow. And so, and if you drop the blood pressure, guess what happens? You get less blood flow to your brain, and then you lose more brain. So it's not a simple question. You need to know why.
Okay, I think Julie had some questions about blood pressure, but I think you answered those. So I'm running out of time. Okay, Elmar says, I still can't figure out the reasons for my blood pressure. You told me to take an AR ratio test and it's normal. Renin activity?
Yeah, renin activity.
Okay, 0.74.
Okay.
Ratio, 9.5.
Okay.
And still 150 over 90 when I go to bed, and 140 over 90 when I wake up. Okay,
so the diastolic blood pressure is elevated, and that indicates that you probably have a stress-induced adrenaline, epinephrine or norepinephrine kind of issue. So this may be a hormone, hormone meaning adrenal, like an adrenal problem. So the next step is to look for adrenal problems. You're muted.
It eventually tells me. It eventually is like, I know you're trying to talk, but you're on mute. Zoom is nice that way. It knows. Okay. I want to follow up here. Tony, he was on camera just a bit ago. He said that he had a clot in his upper thigh and had deep vein thrombosis. And so the hematologist had me on Xarelto for 6 months. I only have 15 more days to take it. As a result of the Xarelto, I'm not sleeping well, and I've not been able to do leg exercises. I still do cardio every day and feel fantastic. Along with the Barton supplement program, diabetes cookbook, I'm totally off all blood pressure meds and diabetes meds. Praise God. Thanks to all of you. I'm spreading the message for you.
Okay, so that the clot, that's a big thing. So being on Xarelto for 6 months, that's, you want to thin the blood and you don't want to extend that clot, because if you have a clot, then you're more likely to add on to that clot, and Xarelto stops that from happening. And that's all it does. It doesn't dissolve clots. All it does is prevent extension of the clot from forming. So, and it gives time for your body to absorb that clot. And so in order to assist in reabsorption, you can take something like nattokinase. Nattokinase is a clot dissolver. It's an enzyme that dissolves clots. So that might be something that would be helpful. And then, because you have that, you want to make sure that you have good glycocalyx. You want to have that layer inside your arteries and veins. You want to have a good layer there. So a couple of things to do. One is to take glucosamine and then take fucoidan. Fucoidan has fucose in it, and there are just very few ways to get fucose. And glucosamine and fucoidan, and then making sure you get enough vitamin E. Vitamin E, and adding extra vitamin E is a good idea. And so make sure it's not the DL-alpha tocopherol. Use mixed tocopherols for vitamin E, because that's what works best. And then get your omega-6 to omega-3 ratio down to normal. So it should be between 2:1 to 4:1, omega-6 to omega-3.
I was just chatting with Dr. Saunders yesterday. I too am taking fucoidan, spelled strange. Yeah. All right. Let me see here. Oh, we're out of time. Dr. Saunders, what are we gonna do?
Need more time.
All right. I don't know that I can do any quick. These are all such good ones. Okay, I will. I had a recent echocardiogram and it showed, already did that one. This is from Douglas, what causes high LPA and what is the best way to lower it?
Causes high LPA. Okay, it's a genetic issue. Your genes tell you what your LPA is going to be, and so the way to deal with it is you're not going to dissolve clots very well. So I have somebody who has high LPA, and for the last, I think it's 20 years, it's more than 10 years, and maybe as long as 20 years, he's been taking nattokinase. And he just takes a daily dose of nattokinase to dissolve clots, because what LPA does is prevents you from dissolving clots. So he has the nattokinase to dissolve clots, and his coronary calcium score is 0, none. So even though he has a genetic high LPA, he doesn't have any coronary calcium. Now, I don't have any studies on that to tell you if that's like a generally applicable kind of thing. Maybe he just doesn't make clots, and that the LPA or the LPA or the nattokinase has nothing to do with it. However, it might be worthwhile to have something like that. And the other thing to do is to not form clots. So making sure you have a good glycocalyx. I would even take a fucoidan and a glucosamine supplement and have a very high fiber diet. Start out with that. And then making sure your omega-6 to omega-3 ratio is really good, so that you have between 2 and 4 omega-6 to omega-3. So those are the best ways to deal with high LPA.
Did you have a dosage of that nattokinase?
Of the nattokinase? Yeah, it's 200, is it 200,000 units or 2,000? I think it's 2,000 units, or like 200 milligrams. Yeah, there's a 2 in there. I think it depends on the manufacturer how that's put together.
Okay. All right. Thank you so much, Dr. Saunders. We appreciate
You're welcome.
Extra minutes.
Okay.
All right. We'll see you next. Let me just see here if we have any other questions that we can help with. You know, I was on the webinar last week, but maybe you know this, Cheryl, something about a certain blood type that's not recommended for collagen.
He briefly talked about blood types, but I do not remember if there was one that could not accept collagen. We talked about doing a webinar, put this on your list, Leslie, about blood types and heart, blood pressure. There is a correlation.
Interesting. Okay. I also saw some questions about acid reflux. That may even be something that we talk about as well, I think. I don't know that we touched on that in any of our webinars. So that might be an option. Okay, so write these notes down.
Karen joined us. Was she wanting to ask a question? I mean, now the doctor's gone. But thank you for going on camera, Karen.
Yes. Let's see.
She's still muted.
Yeah, I can't unmute it. Or I mean, maybe she can't unmute it. I don't know if I have a question from her. Let's see. If you do have a question and you want to post it in the chat, that'd be awesome. I don't think you can post it in the Q&A. And maybe there is one and I just haven't seen it. So I don't see a lot of the stuff in the webinar chat, if I'm honest, guys, because I'm over on the other side trying to do the Q&A, which there are a lot of questions we didn't get to. I'm so sorry. Yeah. Any other ones that we can? Tanya says, thank you all. You have changed the quality of my life. I wish I could have learned about this years ago. Oh, that is awesome, Tanya. I feel the same way. Honestly, I wish I could have learned this when I was much younger. Anything else in here? Just a reminder to go to bartonwebinar.com where you'll find a link to our YouTube channel. Honestly, we post all of these on that channel, and I think they'll be posting the next couple of days. I have them scheduled out, but next week's will be on there very soon also. So I would just recommend you go there. You'll get a great education about type 2 diabetes or how to have a healthy heart and both together. So highly recommend that. There's some other videos there too. We even have some testimonial videos. If you're someone who has had success with the diabetes solution kit or the healthy heart solution kit, or maybe Synachroma or some other product that we have, and you would be willing to share that on camera, I would love to do that so that you could, we just want to get the message out there and help other people. The Healthy Heart Solution Kit, I mean, you can get the digital version of this for under $20. So it's not like we're out there killing it selling these, you know what I mean? So we just want other people to get the benefits that you guys are seeing out of this as well. And same with the Diabetes Solution Kit. Very inexpensive, but talk about life-changing for people who are looking for an alternative. And so if you're willing to do that, send me a message. It's Leslie@bartonpublishing.com. We got to get going, Cheryl. We have another meeting here.
Yeah, we're
So
gonna have a meeting.
sometimes we just start talking and we can't stop, but that's how it goes.
Tony said he'd be willing. So we have to
Yay!
Tony. That's
Oh,
great.
I'd love that. That'd be awesome. Yeah, you've had some stuff going on. It sounds like you're figuring it all out, which is awesome. Okay. So would you email me, Tony? Leslie, Leslie @Barton Publishing. Thanks so much. That's awesome. All right, guys. Thank you.
Bye.
Thanks for hopping
Bye.
on. We'll see you
See you next week.
next week. Bye-bye, guys.